So we're all welcome again and good morning and thank you for joining us. Unison has long embraced the diversity of those we serve, and we are gathered here today. It's vital that we remember the peoples who have gathered here for millennia. This is the Treaty 7 land of the indigenous peoples of Southern Alberta, the Blackfoot nations of Siksika, Piikani, Kainai, the Tsuut'ina First Nation, the Stoney Nakoda nations of Chikini, Bearspore, and Wesley, and the historic home of the Northwest Métis and Métis Nation of Alberta Region 3. It is with the goal of reconciliation that we gather, acknowledging the land on which we are today, and we thank the elders of these nations for their timeless contributions to this land. Again, welcome and thank you for joining us for today's presentation. Yeah, we are very pleased to have the opportunity once again this year to present the 1 month long series of informative presentations on infectious disease, immunization, and staying healthy in body and mind, and supported by an education grant from Sanofi. So we thank Sanofi for sponsoring this. So it is a great hope that the support of several renowned medical professionals, this presentation will have helped to provide you with the information you need in order to make informed decisions about your health and wellness and to keep you safe. I think it is safe to say that just as we all felt comfortable coming back again and looking forward to returning to normalcy, we are unfortunately becoming well aware of the recent increase in the number of people experiencing both COVID and influenza. Reports are that flu season is even going to be worse this year. And it's suggested that we begin to wear masks again, ensuring that we have all taken our immunizations up to date, not only against COVID, but also against the many illnesses that affect our older adults, such as influenza, pneumococcal, and shingles. All of these routine adult vaccinations we should be aware of to help older adults maintain good health. With that in mind, today's presentation is very timely. It's a very timely one indeed, if we all agree. So we are very excited this morning to welcome Dr. Mary Szabo. So Dr. Mary Szabo is a family physician and clinical associate professor at the University of Calgary and has an extensive career practicing in Saudi Arabia, Pacific Island, and Ontario. So it is now influenza and pneumonia season. We need to think beyond COVID. Actually, what is a myth? We need to know what the truth is when it comes to immunization. And I'm sure that Dr. Szabo would be able to shed light on this for us today, and we'll be able to take vital, things home today to help us with our health and our wellness. So Dr. Szabo, I will gladly give you the mic and you take it away from here. You're all welcome and hope you enjoy the presentation.
Great, thank you very much, Lola, for the very nice introduction. And thank you everybody for taking the time today to attend the Zoom meeting. As Lola say, I'm a family doctor of about more than 40 years, and my passion is actually in preventing medicine. And vaccination is actually the most effective effective way of preventing disease. So at first I was thinking of smart aging from a chronic disease point of view. I decided to make it a more infectious disease friendly, taking a look at all the recent data about influenza, COVID-19, how our senior can take, make a proper decision during this epidemic to safeguard their health. So without any further delay, I would start my presentation, and I would be more than happy to answer any kind of questions when the presentation is done. So winter is coming, and it comes every single year. And a lot of us, we really think that winter is exciting. We get to see our family, Christmas, any kind of holidays, winter sports. But one thing that all of us forget is the seasonal cycle of respiratory viral disease. And it has occurred thousands of years, and it hit the human population just like a clockwork in the Northern Hemisphere. So, every single year in the winter time, we will see a seasonal cycle of epidemic, the common cold, the flu, and a number of the non-flu viruses. And this is because there's a number of environmental factors from the point of view that colder weather allows the virus to be really quite stable and enhances the transmissibility of the virus itself. The host itself, such as people who are 65 and older, with the age and increasing prevalence of chronic disease, actually make them more prone to infection. And also those who are younger than 65, but they're immunocompromised because of disease or treatment. So the host factor has a lot to do with it, as well as the virus. The virus can be a mild one, but they can mutate in such a way that they can be quite transmissible and quite lethal for the host. And human behavior, as we went through a really cold spell, and all of us stay inside the home. And then with holidays, the transmission between person to person also increases. So the most effective way of preventing infection is actually through vaccination. And during the pandemic, the COVID-19 pandemic, preventing influenza is a very important strategy to make sure that the resources are not overwhelmed. So infection and the senior is interesting from the point of view that for the past decade, the life expectancy of senior has increased, and that the increase of life expectancy actually paralleled the prevalence and the mortality of infection from senior. And infectious disease actually account for almost 1/3 of those who are 65 and over. Now, there is a number of, contributing factor aside the advancing age. As we grow older, our immune system is actually more weak, and their response to fight the infection is much lower, and they are much more prone to have chronic disease, and chronic disease has a lot of impact on infectious disease. And the weakened immune system also attribute to the severity of the infection as well as the mortality of the infection. Another very important thing in which I actually see from my office, that senior responds to infection in a very different way than younger people. So their atypical presentation will make the diagnosis actually delayed until they go into a blood infection, which carries a very, very high mortality. So senior response to an infection, they might not have a fever, and they might just, and they might not mount a white count, they might not have a lot of symptoms, but they might just be manifest as something like the functional ability drops, and the mental status also changes. And so the delay in diagnosis also increases the risk and high mortality. So this slide is just a very brief slide to review what influenza is. As you say, is a very contagious respiratory disease, and is caused, which can infect our nose, the throat, and the lungs, and is caused by single-stranded RNA, influenza A and influenza B. And as you can see that both influenza A and B can cause a pandemic, but influenza A have about 198 relatives, and while B is only 2 lineage. And you can see that most of the severe cases for influenza is caused by the A, and it can affect much more in the elderly, and influenza B is much more affected for the younger population. They too can actually cause severe disease. And I say it can be, very mild to the young people without medical condition, but it can be very severe and it can cause death. So this is a slide to show that, common cold are very mild and benign. And I put up the symptoms between COVID and influenza. It's extremely difficult to tell influenza from COVID-19 because they're very similar. At first, we sort of say maybe the loss of taste and smell might be much more specific for COVID-19, but with the new variant and the mutation, this is no longer true because the new variant now doesn't have a lot of symptoms, predicting to smell and taste. So the only way we can do the difference is by testing. So what's the burden of disease? The burden of disease, as you say, worldwide, every single year, we have at least 1 billion cases every single year. And up to that 3 to 5 million have severe influenza-related illnesses. And worldwide, we have close to 300 to 600,000 flu-related deaths. In Canada, in general, we have about 3,500 flu-related deaths, about 12,000 hospitalization, and 2.5 million of lab-confirmed cases of influenza. As it shows in this diagram, it's just the tip of the iceberg. And the 2.5 million is really an underestimated number because a lot of people who has the flu do not seek medical advice. And as I said in the previous slide, the influenza respiratory can affect the respiratory system. It can give us sinusitis, sore throat, but it also can affect our lungs, and it can get our chronic lung disease a lot worse. But on this side, I show that, it's not only the respiratory system in which the influenza occur, it can also cause a lot of other systems which is not related to the lungs, such as the cardiac system and such as the neurological system and some of the chronic disease like diabetes and chronic kidney problem. And that accounts for the bottom part of the iceberg. So you take a look at the disease burden, it affects, the impact of influenza is really very great. This slide is just to remind us that, although senior account for maybe about 20% of the Canadian population, but they account for 70% of the hospitalization and 91% of the deaths related to influenza. So this is healthy aging. We all would like to have a gradual easing to aging. If you look at Statistic Canada, 92% of the seniors still stay in their own home, and we like to be that way. But one health event with influenza leads to hospitalization and sedentary with bed rest really increase our disability and decreases our dependence. So that is something, this is much more valued by my population of senior in my practice. These are the common chronic disease which 65 and older individual have, and these are the common 5. And the reason why the older adults are more particularly, vulnerable to infectious disease is the concept of immunosenescence. What immunosenescence is, with aging, our immune system actually changes. They don't mount a very robust defense system when they are infected. And so when you give them immunization, they also do not mount a very robust response as opposed to, your children or your grandchildren. And if you give a senior a vaccination, they might mount about 30% of the response of the younger people. And as we grow older, the number of chronic disease also goes up. And this is the reason why we're more susceptible to complication of the infectious disease sequelae. This slide just shows that as we grow older, we will have more and more numbers of chronic disease. And so, when you grow from age 20 to 64, approximately 30% of this age population will have at least one medical condition. As you go up the age greater than 75, senior will have at least 2 or 3 more chronic disease. And that actually increases mortality when we have infection. So this is an example to show that if you have underlying heart disease, you're 5 times greater to have actually influenza attributing mortality. And if you have lung chronic disease, you increase it by 12 times. And if you have both, you increase this by about 20 times. So this slide is actually taken from NASA 2020. So as you can see, that's an individual level of decision making and a public level of decision program decision making. This slide is actually made by the provincial and the federal government, mostly provincial. Individually, this is what NASA recommended is the high dose should be offered to anybody who's 65 and over due to all the reasons that I just went through. However, if this is not available, then in that case, any kind of standard dose subsidized for, by the provincial government can be used, and I highly recommended that get vaccinated regardless of what kind of vaccine that you can get hold of. Christmas is over. I prepared the slides actually before Christmas. So I thought what we do is quite relevant to sort of do a Christmas carol with an influenza twist. So the Jacob Marley from Australia flu season usually start between April to about September. And you can see that, and we always mirror the Australian data. And as you can see that the number from this graph, they usually peak at about August and September. But this year, they peak much earlier in about, May or June. And you can see that the graph, this yellow line is the 5-year average. And when they peak, it peaks really early and it exceeds the 5-year average. And I gave a talk to the pharmacists prior to the flu season, encouraging the pharmacists to roll out the vaccine program as soon as possible. And in our clinic, when we get the vaccine, we start to vaccinate everybody because of anticipating the early peak of the influenza season. So what is the season of this influenza past? As you can see that actually flu is not a new kids on the block. It's been around since the age of Hippocrates. And he noticed that every winter solstice, he noticed that people are having respiratory tract symptoms right on the dot every single year. And in 1300, when the epidemic hit Florence, the Italian basically dubbed the disease as influenza di freddo, means cold influence. And that's how influenza occurred. And as you can see, the pandemic occurred almost every single century. If I move this to the right, you will see how it goes. So from 1918, you have the really worst pandemic caused by H1N1. And then during the subsequent years, you can see that there is pandemic in 1960, 57, 68, 77, and the latest one is 2009. What 1918 flu, you can see it has been dubbed, the virus has been dubbed as the mother of all pandemic, is because scientifically, when a virus causes a pandemic, they never comes back. But H1N1 recurs in, actually, you can see in 1977 and 2009. So that's the reason why you notice that the flu vaccine always contained the H1N1 subtype, okay? And, you know, and you can see that progress has been made. And in 2005, the breakthrough is they basically completely sequence the viral genetic for the H1N1, and that really helps the scientists to develop a vaccine. So this is what happens in the Spanish flu. And if you look closer to this, the cat is also masked. Okay, so you can see that the restriction, there will be canceling activity, everything is restricted. And the Spanish flu causes about, you know, 50% of flu-related death is actually younger people. And it doesn't start in Spain. Actually, the one originated is from China. And from March to May of 1918, about 11% of the soldiers got caught the respiratory illness. So it's a very bad pandemic. So this is the spirit I would like to put to impress on you how influenza causes an epidemic every single year. But what happens here, okay? In 2020 to 21, I want you to remember there is a gap there, okay? Because that is very relevant to the flu season this year. So move forward, and you can see that, okay, so this is actually, this is actually the data from Alberta. It's exactly the same. This is the gap in which we don't see any kind of influenza activity, okay? And moving forward, so a lot of people would say, hey, Dr. M is fantastic. We don't have any kind of influenza at all. And it may be people would say is maybe we're not testing enough. This red curve is the number of influenza testing during 2020, 2021. And you can see that we tested a lot more. So it's not that the numbers of influenza is down because we don't test, because we test a lot more. But look at the activity, okay, in 2020, it's flatline, okay? And no one is getting influenza. So in that case, you know, so a lot of say, hey, that's fantastic. If we don't see any kind of influenza is gone. But that is very, how would I say, too optimistic, because what happened is these kind of data actually should raise major alarm. And when there's a lack of influenza activity the year before, that doesn't mean that it's going to carry through, because what it actually created is what we call immunity debt. And immunity debt is actually conducted by study conducted in France, and they find out that the lack of exposure to influenza or to any kind of regular viruses and bacteria, because we suppresses the COVID-19 by social restriction, hand washing. So those, the benefit of, preventing influenza is there, but it's very short term. Lack of circulation, actually, when the virus resurfaces, is going to hit the population really hard, especially the younger generation. And this is exactly what we're seeing in very early part of this influenza season. Lack of activity also is not great because in February, WHO usually will select the strain of virus to put in the vaccine. But if nothing circulating, it's going to be very difficult for the WHO to decide on the vaccine. Thirdly is complacency of vaccine. A lot of people say, Dr. M, why should I get there? You know, we got rid of influenza. There's no activity. I don't need to do anything. So that is a danger, that lack of activity is not a good thing. So what is the current situation? The current situation, basically, you can see that this is 2020, then you have a gap in 2022. This is worldwide data. You can see the sharp peak, very early and very, very high. And this is we will see worldwide. And this is nationally in Canada. As you can see that these are actually December data from the fact that very early on, these are widespread and is spreading like wildfire, you know, across the Canadian system. And these, what you can see is what kind of virus are we seeing? You can see that a lot of time this is unusual. We usually have a balance between influenza A and influenza B. But if you take a look across the spectrum of from 0 to about 65, they all influenza A. Influenza B is almost non-existent. And so what kind of influenza A are we talking about? This one is H1N1. We usually see the H1N1 in the younger population, but look at this year, they're all H2N3. And this virus is causes a lot more severe diseases. So you can see that there are more younger people being hospitalized, especially deaths and intubation. This is just a graph to show you this is the average 5 years. This is this year in, influenza activity. And you can see that it peaks really early and exceeds the 5-year average. So what is it that, if I can draw your hospitalization, a lot of times what we're seeing is actually, hospitalization in the older age group, the 65, but you can see that the young and the old have the highest mean of hospitalization. This is the national average, but you can also see an increase in hospitalization in the younger age group as well. And this is to remind you, this is actually the Alberta data. You can see that nothing here, and then you have a late peak the year before and a very peak early influenza activity for this year. So we forget that there are other viruses which also co-circulating with influenza. And this year we have 3 candidates. So this is the influenza virus, this is the coronavirus, and this is the respiratory syncytial virus. So these are the top 3, but out of that, you have the adenovirus, you have the parainfluenza virus, you have a number of cases which actually, a number of viruses which circulate during the winter months. And once when you're infected with one virus, your immune system will find it very hard to actually combat a co-infection. So this graph is to actually show you that the adenoviruses, can occur. And these are the number of viruses which usually can co-circulate with influenza. And this year you can see that the respiratory syncytial virus has just jumped way up. And that's most likely is because of the immunity debt. Everybody, all the young people are safe, they're isolated, school were closed, so they don't see the respiratory syncytial virus last year. And when it resurfaces, it really hit this age group really badly. And that's what we see the peaks in. And this is just to show you the co-circulation of the other viruses. So as you can see, the influenza B is really not there, not as bad, but you can see the respiratory syncytial virus. This is the average, peaks early and also, peak on above the average. And then if you move over to SARS is doing, COVID-19 is doing very, very well. And if you take a look globally, China is having an epidemic. We're seeing a variant, from Omicron 5. And so it is a mess. And this is just to show you that influenza A peaks much higher than the average and very early on. So this is just the data showing that COVID-19 has not gone away. And so to ensure, to emphasize that we're dealing with other forms of virus besides the flu. So we sort of say, okay, I highly recommend vaccination, even though some of you might say, well, Mary, it doesn't really work. But look at our vaccination rate in the past. The senior group is the best, even though the target for both Canada and WHO is that you need to have 80% of the senior vaccinated, and we're sitting at 7%. So we're not doing great. And if you take a look at Alberta for this year, senior did the best. And if you take a look, the gray line, which is overall jab is around 20%. So the immunization rate for the flu, nationally as well as in Alberta is actually not very high. So why is it nobody takes the flu vaccine? Okay, I have to say that our senior patients are excellent. Once when we get the flu vaccine, we phone them to get all our senior in to get the high dose vaccine, get them vaccinated, and we open up to the relatives, etc., to get everybody vaccinated. One of them is I am protected from herd immunity. What it means is I'm okay, Mary. I need everybody to be vaccinated so that I'm protected because they don't get sick. But as I showed in the previous slide, what happened? Only 20% of the general public. And you need at least 50 to 60% of the general public to be vaccinated in order to have herd immunity. The second thing is, well, I already have the booster, I really don't need, because there are some patients who truly believe that if you are vaccinated against the COVID, there's no activity for the flu the past year. I am okay, I'm fine, I'm protected, okay? Some of them would say, I don't like being sick, sore arm, and so I don't want the flu, but I will get the COVID vaccine. And the other one, which is very common, is I'm young. I only get sick. And if I get sick, I stay at home. But don't forget they have younger children younger than 5 is the high risk for severe flu infection. And we also grandparents, okay? And for senior, you have grandkids and you have children. If they are not vaccinated, they can pass on the disease to you, even though you're vaccinated, because your response to the vaccine is not as high as the young one. And, and the last one is, hey, I'm fine. There are no flu around, so I'm good. Right? So what is the future? We're still in fairly early flu season. As you can see that our flu season really occur early. We generally start to peak in January and February, Okay, so, if the vaccination rate continue to be low, COVID-19 continue to mutate, and you will see a rise of the new variant, RSV continue to go up. This is what you will hear. You have a triple demic going on, and people can get more than one respiratory disease, such as you can get RSV with the flu or COVID with the flu. And when you do get that, you can get really, really sick and increase your mortality rate as well as your hospitalization. And you'll be seeing headlines like these on the news in which we are overwhelmed. And I just, 3 or 4 weeks ago, this is what we heard across Canada, the plea from infectious disease. We're overwhelmed. We're going back, we're afraid that we might be going back to restriction and masking and everything. So you can see that these are the news headline. If we continue the trajectory as we are, we're seeing more young people in terms of hospitalization and ICU, and then more Albertans in the younger age are dying from COVID-19. So what do we do? The thing that is very important is, even though the vaccine is not 100%, get your jab, okay? Get your COVID-19 bivalent, as well as get your high-dose flu vaccine. This is the thing that we can do. But beyond that, you're much better off to have your shield to protect you from influenza and COVID than to have no shield at all. Okay, and personal prevention measure, when I go out in a crowded place like shopping and grocery, I wear my mask and I actually would wash my hand so that you can stop the infectious disease. So what's the take-home message? The take-home message: flu is around every single year. Senior at high disease burden. There are other risk individuals such as the very young, people less than 5 years old, and people immunocompromised. And there is a risk of a triple pandemic, a triple epidemic this year. And with the 3 virus co-circulating, we're going to strain our healthcare resources. And vaccination is the best protection to protect yourself as well as your loved one. And that's all I have.
Thank you, Dr. Szabo, for such an informative presentation. I'm sure our guests will have lots of questions for you. So I will invite everyone to pose their questions in the chat box. So I have one for you right now. It says, what is SMC?
Say again?
What is CMC? Yeah. CMC.
Chronic medical condition. So such as high blood pressure, heart failure, diabetes is chronic medical condition.
Oh, chronic, okay, chronic medical condition. And you can also raise your hand and I would unmute you if you want to speak through the microphone so Dr. Szabo can take the questions. So, okay, someone just said Dr. Szabo. So you can put your questions or raise your hand and we can unmute you if you have any question. This was quite insightful, especially the gap between 2020 to 2021. I found that really informative, that we thought we were not having influenza, but unfortunately it made the next year worse. So, okay, so someone is asking a question. She said Spanish flu started in United States, not from China.
The Spanish flu, you're absolutely correct. It started in the USA, but what happens is during the First World War, China sent the workers to the United States to help with fighting the war. And the workers that they sent from China actually contacted the H1N1, and they carry it to the United States to the military camp. And about 3 weeks after the workers arrived, it started to infect the soldiers. And because of the war, and they sent soldiers in, there it will actually spread worldwide into Europe during the war zone. It is called the Spanish flu is because it brought to the attention the H1N1 flu was not made public because they really did not want to demoralize the population and the world. Not until the festival in Spain, I think it was the running of the bull, they decided to still carry on with the festivity. And about 2 weeks after the festival, there is just all hell broken loose in Spain. And that brought up to the media, and it was dubbed Spanish flu. So it is originally from the US, but it was brought in by the Chinese worker in which China sent. And the disease actually started it, but it was brought over to the US.
Oh, thank you for that insightful response. We have another one. It says, how should we reply from Darlene? How should we reply to someone who says the vaccination causes autism?
Yeah, it is one of the really common myths. And I have to say that it's really, really, really sad. In 1960, there is a scientist who make association of the, basically it is the MMR vaccine, mumps, measles, and rubella vaccine, which is a live virus vaccine, causes autism. And he published a paper inciting for the fact that if you have the vaccination, it will develop autism. And the damage is so bad that, subsequently, there are numerous studies which has rebuked that observation. And this scientist actually, what happens is they make the correlation by studying within the group of the youngster between about 18 to 23 months, which is actually a very common age to have autism, to detect it. And he combined with the gut flora, tied in with the measles virus in the gut, and make that decision. And since then, the journal has actually withdrawn the article, and the British system, judicial system, also find that particular doctor to be irresponsible and have charged him. But that had caused us so much damage that, we still have some parents who refuse. So my answer is basically sort of say, vaccination, especially the MMR, children vaccine, do not cause autism. And there are numerous studies to support that it does not cause it. Okay. And that's what my response is.
Oh, beautiful. Thank you, Dr. Szabo. We have another question here. He said, why is Alberta government not covering the cost of the new efficient pneumonia vaccination?
It is a political, it is a political question which I cannot answer. So the pneumococcal vaccine, the new one is called Prevnar 20. So as you see that there are two pneumococcal vaccine, one is called Pneumovax. It's a totally different type of vaccine compared to the Prevnar 13 or the Prevnar 20. Is a totally different type of vaccine. So the newer pneumonia vaccine was not even covered by that. Part of it is this: we vaccinated our children with Prevnar 13 because our younger population, children do not respond to the encapsulated vaccine. And now we're at the age for the fact that we have created herd immunity because it's incorporated into childhood vaccination. So there is no, how would I say, need to actually promote Prevnar 13 because every single children has been vaccinated. So your risk of getting a pneumonia from those 13 subtype is lower. Now, Prevnar 13, 20 just comes out with 20 subtype, and it is new on the market. And like any, provincial approval, they would not cover until they study the valid and then balance of the subject, just like high-dose flu vaccine. We worked very hard with Sanofi for the past 2 years to get a high-dose flu vaccine approved and covered. And I would hope that the new Prevnar 20 will be the same thing. One good thing is on an individual basis, as you can see for NACI, there are two recommendations. One is the individual recommendation in which a family doctor and your primary care physician should talk to you as to what kind of vaccine which will be the very, very best for you. And the provincial recommendation is what vaccine they would cover. And in my practice, anybody who's 65 and over, especially with comorbidity, I actually recommend them to invest into the Prevnar 20. And one good thing about the Prevnar 20 is you only need one dose, then you're done. It will cover, you don't need the other vaccine, the other pneumonia vaccine. So I talk to my patient and weigh in the pros and cons and basically sort of say, if you're 85 with a pneumonia, it's not good. And if you have chronic morbidity like cancer, immunocompromised, maybe you would need to protect yourself a little bit more. And I would suggest that, have pay out of your pocket for the new vaccine. So hopefully this will answer the question.
Thank you. I just want to remind us that we still have a few minutes to ask questions. You can either, come on the chat and just put your question in there, or just raise your hand and we'll unmute you to speak through the microphone.
These are all really good questions. I'm
Yes,
really
great questions.
Yeah, I'm really happy and impressed that you guys are so engaging because it has a lot of clinical implication, for yourself as well as for your family. So
how often, so there's another question from Megan. How often should you get the pneumonia vaccine?
So if you get the new Prevnar 13, it's a 1-dose deal. That's it, you're done. And depending on what vaccine that you're talking about, the one which is covered by the government is called Pneumovax 23. And generally, if you are a healthy 65-year-old, you don't have any kind of comorbidity, I will generally give it to people when they're 65. But for people who have chronic lung disease, asthma, chronic obstructive lung disease, or immunocompromised, you can give them the government-funded pneumococcal 65, and then you can give them a booster 5 years afterwards. Okay, you have to be a distance of 5 years. And then at 65, you get booster, because the major problem with that vaccine is the more booster that you give, your immune system responds to it less and less. So that's why, we always follow up with, if they have the Pneumovax 23 first, then after a year, I'll follow up with the 13. Now the 13 has been replaced with the 20. So if you don't have anything before, or if you have the Pneumovax, the government-funded one, a year afterwards, have the brand new one, pay for it, then you're done. There's no more booster.
Okay, we have another question here. Thank you for that. Darlene, she said, my tetanus shot is overdue. could I obtain my tetanus shot at the same time as my influenza shot? So can I take both together?
Absolutely.
Mhm.
Absolutely. So for people 65 and over, there's 4 vaccines in which we're looking for people to be vaccinated. One is a tetanus shot, tetanus, diphtheria, and pertussis shot. That is a need to be booster every 10 years. And I absolutely recommended that to make sure your family doctor will provide you with the booster every 10 years. Your annual flu vaccine, which is a high dose, which is covered by the government. Your Shingrix vaccine, which will protect you from shingles. And that's only 2 doses. And unfortunately, that is not covered by the government. The Shingrix is a very effective vaccine, and you only need 2 doses, then you're done. And the pneumonia vaccine, either the new Pneumovax 20, then you're done. Okay, so those are the 4 vaccines in which are highly recommended, but definitely you can have 2 shots, 1 in each arm, and that will be fine.
Well, thank you for your response, Dr. Szabo. Thank you so much, Dr. Szabo, for this very important presentation. And we want to thank Sanofi for providing the education grant, enabling Unison to keep seniors informed. I hope everyone gained some good takeaways. I did, and I'm sure lots of us did. And I want to especially thank all of you for joining today. And I hope that you have good takeaways. And
I also would like to thank the participant in taking the time to attend the presentation.
Yes.
Thank you.
And for the participants too. Thank you so much. Great information. Lots of accolades for you. Thank you. Thank you very much, Dr. Szabo. It's very informative. Thank you. Great information. Yes. Yeah. We thank you so much for doing this. And participants, have a nice day and enjoy the rest of your day. Okay. Bye for now.
Bye.
Bye.